Hello friends, welcome to our channel. So we have been discussing what are the symptoms of COVID-19, how to treat and when to give what medications and what investigations to take. So many have this very basic question. So after getting COVID-19 infection, when can one be sure that the COVID-19 infection has resolved completely? When can he start saying, okay, I have come out of this COVID-19 and I can start doing the regular work? So should I repeat on RT-PCR to find that whether the COVID-19 infection has settled or not? So all these questions I am going to address in this video. So again, going back to the basics, as we tell repeatedly, the COVID-19 infection has initial viremic phase where the virus replicates or multiplies in the throat, nose and all this, and causes symptoms such as cold, cough and some throat pain or something like that. So at this stage, RT-PCR will come as positive because virus will be found in the throat. So 80% of the people, they just get COVID-19 infection as a simple common cold or a flu. So around 50 to 20% of the people enter into second stage called the inflammation stage, and only in this stage all this lung infection, lung involvement, blood clots and breathing difficulty and all this gets started. And this starts around 7 to 8 days and sometimes as early as 4 to 5 days, and the danger period is up to around 12 to 13 days. By around 14 days, if the person doesn't develop any signs of this inflammatory stage, one can be sure, almost sure, that he has not entered the second stage of infection. Why this is important? Because we all have seen one important T20 match between India and Bangladesh in one T20 World Cup. So Bangladesh were about to win just some 2 or 3 runs to achieve the target. The Bangladeshi batsman prematurely celebrated the victory even before reaching the target 2 balls before. But the next 2 balls, I think they were wickets, and Bangladesh lost that match and India luckily won that match, and all the premature celebration went for waste. And it was a great meme material and lots of memes came about that premature celebrations. So that should not happen in COVID-19 infection. So many people by day 4 or day 5, they will have some relief of symptoms and fever will settle down. So many have that joy, okay, I have overcome COVID. No, most of the people, COVID can enter the second phase by around 7th or 8th day. Around 7 to 8 days and up to 12 to 13 days is very significant. So people who have got improvement of symptoms in the first 4 to 5 days can have reoccurrence of fever, then again starting of new onset of cough, then again breathing difficulty after 6th, 7th and 8th day. So that is very important. So we should not celebrate prematurely like that Bangladeshi batsman in the T20 World Cup. We have to wait for 14 days. So should we do an RT-PCR to confirm? So many people are doing one RT-PCR by day 10, day 14 to tell that okay, I have come RT-PCR negative. It is meaningless because after 7 days, the virus itself will enter the lungs. When the virus enters the lungs, it will be always negative in the throat. So definitely it will come as negative. So what is the reason in using RT-PCR after 7 days or 8 days? It is meaningless. So a person is not proved to be COVID-19 negative with just this repetition of RT-PCR. It is meaningless. So a person has to be observed clinically for 14 days at least from the onset of symptoms. From the next 14 days, if it doesn't develop any breathlessness or any cough or any fever, he can be sure that okay, the COVID-19 infection has subsided. So we should not prematurely celebrate like the Bangladeshi cricket batsman. What about the people who have developed this moderate to severe symptoms, developed pneumonia, developed lung infection, developed breathing difficulty, required oxygen, required hospitalization? So all these people should be careful. So before discharge, doctors will see whether the saturation is stable for at least 2 to 3 days in room air, and only if it is okay, they will send home. And sometimes if hospital beds are not there, a person can be sent home even with oxygen concentrator or home oxygen. These people have to be little bit careful. So even after discharge, they have to be careful for the next 2 more weeks. So sometimes rarely people who have got discharged and who have gone home are coming back with again breathing difficulty, again problems, even deaths have occurred in the weeks after discharge. So people who have developed moderate to severe symptoms of COVID-19 infection, they have to be careful even after up to 14 days of discharge from hospital. So most of the guidelines say that after RT-PCR is positive, at least for the next 2 weeks he should not meet any other person and he can be infective to others. And in case of moderate to severe persons, they have found that they can shed the virus even up to 28 days from the day of onset of symptoms. So even after discharge, the same 14 days rule apply here. Even after discharge for another 2 weeks, one can transmit the infection to others. So keep all these facts in mind. So don't prematurely celebrate and land yourself in trouble. Always go by the clinical symptoms and clinical monitoring. That is most important. Repeat RT-PCR are useless. It will only lead to confusion and problems.